Some people might not really know what it is, right? So there's this healthcare sharing ministry called Sharity, and yeah, it went bankrupt in a bad way, and it left over 10,000 families unpaid medical bills.
Oh my gosh.
Now, Sharity is what's called a healthcare sharing ministry, and this is a thing that's kind of become pretty popular among Christians, or I would say specifically evangelical Christians, as an alternative to traditional health insurance.
Right.
In many cases, these healthcare sharing ministries are a good bit cheaper than regular insurance companies. And it attracts people for a number of reasons. But like one of the big ones is that, somebody might, kind of say, like, I don't want my money to be used to pay for someone else's unbiblical lifestyle.
Right.
So like these ministries wouldn't pay for anything like an abortion. They wouldn't pay for a pregnancy. So if like somebody's teenage daughter got pregnant, like this wouldn't cover any of that.
Yeah.
Anything that a Christian might think is objectionable. Like it won't pay for, like a liver transplant for somebody who's an alcoholic.
Yeah.
I'm hoping that all these things that I'm saying kind of raise up as red flags for anybody listening to this. Cause you can't, as a parent, control what your children do.
Right.
So like if your daughter gets pregnant, well, that's something you have to deal with, but it's like, you're the one paying the premium, not her. So it's like you're punishing somebody else's daughter who needs that help. Like, it's not Christian to say, well, we're just not going to help you now.
Right.
But like the big thing is that like these ministries, I don't really think calling them ministries is quite fair.
Yeah. I don't think they're ministries.
Right. But like, that's the big draw, right? Is that you can basically punish somebody for not being Christian enough. And, for some people that's an attraction, but, for others, it really isn't. But in this case, this company, Sharity, which at one point was called Trinity Health Share, they've run into a number of problems. A lot of their services.
Hold on. Before you go on,
Sure.
Really quick, let me just, so I think you're absolutely right that one of the things that makes these attractive is people don't want to pay for unbiblical lifestyles. I remember these kind of health sharing organizations getting really popular when it became clear that Obamacare was going to pass.
Yeah.
So there was a very political element to this of I refuse to buy into anything that has to do with liberals or Democrats, or like you said, I don't want to do anything that has to do with, girls having abortions or people doing drugs. But there was a very political aspect to it as well that really kind of took over the zeitgeist for a while. And it's an important thing to talk about because not everybody has a traditional job that has benefits, right?
Right. For some people, this is really the only way they're going to be able to afford to get some kind of insurance.
Any sort of insurance, because we all know in the modern age that all it takes is one bad event in your life to send you to the emergency room to make you go bankrupt and to pass that debt on to your children. So everybody was feeling the pinch of how do I make sure I have some sort of at least minimal coverage. And everybody was feeling like there was a moment in time where everybody was feeling like we've got to have something, right? And so everybody was scrambling for some sort of coverage of some kind.
Yeah, and the Affordable Care Act had allowances for this kind of coverage.
Right.
Even though nothing about these healthcare sharing ministries equates to insurance coverage, they were a suitable substitute, if you will.
Right. And so I guess my point being that the people who founded these health sharing kind of organizations, they knew this turbulence was coming. They knew this fear was on the horizon, and they knew if they were smart, they would be able to cash in on it.
And like, this is a case of a company doing exactly not that. So like there's a lot of things around this particular lawsuit. Actually, there was a couple of different lawsuits, but in particular, in California, there was one that because they were sued because, it turned out that Sharity had been, denying the vast majority of claims.
Right.
And were paying out an average of 16 cents on the dollar on premiums,
Right.
which is ridiculous. And so they were accused of illegally running, or running as an illegal insurance company.
Sure.
Because they were making promises that they weren't fulfilling. And that's an issue there. And all this kind of seems to come from one place, and that was that they outsourced all their processing to some for-profit company. So you have a not-for-profit, healthcare sharing ministry that's outsourcing their stuff to a for-profit company, which, if they're for-profit, they're really cutting corners.
Yeah, I've got to believe, though, that, so I'm sure that contributed to it, but I'm sure that if you're only paying out 16% of the claims, you're taking most of that money and just putting it in your own pocket.
Oh, yeah. I mean, they're going to be taking out, their overhead from whatever they're doing, and then they're passing on the rest to this other company, which is taking out their overhead.
Yeah.
And, and it seems from what I was reading, that didn't state it explicitly, the over company, Sharity, wasn't actually providing any oversight for their contractor here, which was Eliera, if I'm pronouncing that correctly.
Yeah, we never talk about lack of oversight. That's
amazing. Yeah. It's just, it's not a theme that we've had at all.
No.
And there was an organization called the Alliance of Healthcare Sharing Ministries that called Sharity a sham front for this other company, Eliera. So, it was either, Eliera either created this, Sharity as a front for itself.
Yeah. Or
it was a bunch of people that were kind of jumping on that fear bandwagon because of the Affordable Care Act and didn't want to have, Obamacare and didn't want to have, anything around that. So they got this. And I mean, it's a shame because there are issues with these organizations. I mean, we've already talked about a couple, but one of the things I was looking into it a little bit here, and aside from the fact that they're not insurance companies, so their payments of claims is completely voluntary. There is no set standard that says, this is what's going to happen.
Right.
I know that with, my Blue Cross Blue Shield, I know exactly what is and is not covered.
Right.
Under normal circumstances. They can't just say, well, we're not going to pay this doctor bill. No, you pay all these doctors' bills. That's how you work.
Right.
If you're paying premiums, and I don't know what the premiums of these things are, but if you're paying premiums for your family, and then when you need that cash and you're not going to get it from them, it's well, that's not saving money.
Yeah. There's also an aspect of this. Let me see. How can I explain this well? I can pay X amount of money for Obamacare. I can pay 3X amount of money for some sort of commercial insurance, or I can pay 1/3 X the amount of Obamacare just so I don't get fined by the federal government for not having insurance.
Right. And a little, dark secret that I stumbled across in my research here was that even though healthcare sharing ministries are allowable under the Affordable Care Act, they regularly, and that is to say the pattern of these is that they do not meet the minimum coverage standards for the ACA.
Right.
So these organizations can actually have less coverage than what you would get from a basic insurance company.
Right.
It's imagine that's you're paying insurance, but then rather than paying a $20 copay for a doctor, you're having to pay, $180 every time you go see a doctor.
Yeah. I love the double-sided sort of this. On the one hand, well, I'm going to pay next to nothing just so I don't have to pay the Obamacare fine. But then when the Alliance of Healthcare Sharing Ministries calls us a sham front, we're going to say religious persecution. They're persecuting us for following our faith beliefs. It's no, we're calling you stupid because you're stupid people who doing stupid things for stupid reasons.
Yeah. And we're not calling anybody stupid.
I'm calling people stupid. Yeah. Okay.
Well, I mean, who's using a healthcare sharing ministry for whatever reason.
Right.
Like you have to make up these decisions on your own. But I think a lot of people operate in ignorance here.
Right. But
You
here's the
know,
thing, like you actually have to be apparently you have to be super smart to figure out how to be one of the 16% who actually gets a payout. You've got to figure out how to call the right people and nag the right people with letters and phone calls and emails until they finally give in and pay your claim.
yeah.
You know,
Now
so
this is not to speak of like, this is not how every one of these healthcare sharing ministries works,
yes, it is.
you know.
Right.
Like this is one that was, especially gnarly. Like, there are a number of sharing ministries out there that people are happy with and like they are glad to be using them
Right.
and have had good experience with them. But, bad stories abound too,
Yeah.
and so it really kind of comes down to like, you as a Christian need to be aware of what you're getting into if you're thinking about using one of these healthcare sharing ministries, and just to point out, like 30 out of 50 states in the union exempt these sharing ministries from conforming to any kind of insurance codes,
Right.
and that's kind of funky. And the other ones just don't explicitly exempt them from those codes.
Right.
But there may be other things in their laws that allow these, ministries to just kind of skirt like the way insurance companies are supposed to work. And, when we're talking about like, like what is the point? Like, why am I bringing this story up in the first place? It's because I don't want Christians to get, scammed out of money that should be, working for them.
Exactly. Right.
Because like you and I have actual health insurance, and I'm been having nothing but good experiences with my health insurance.
Yeah.
And I don't want some other Christian to think, hey, I can't afford good insurance. Well, yeah, you may not be able to afford, like the same insurance that like, the people in Congress have, which, puts all of ours to shame.
Yeah.
But at the same time, it's like you can do better than this. I mean, you really have to understand what your situation is. So it's like you have to know what the risks are.
Yeah.
And know what the differences are. And then, like I mentioned earlier, some people like they specifically want to go with these sharing ministries because of their moral objections to some insurance provider, paying out for abortions or anything like that.
Yeah.
And I'm going to sound maybe a bit callous, but my recommendation to you is get over that, because is it going to serve you and your family to have better health insurance just to avoid participating with this? I mean, if it's that important to you, then maybe what we need is actual Christian, I'll put that in quotes, Christian, insurance companies.
Yeah.
Like that are from top to bottom run with Christian principles, not like the Dave Ramsey organization.
Right.
Just want to throw that out there.
Yeah.
But it's
so
like,
couple things here. The whole get over it thing. We now live in a day and age where people would rather, when they're on a flight, they would rather force the flight back to the gate and deplane the whole plane than put their mask on. So I think the day and age of get over it is kind of over in America. Like we are now clearly in the age of I will take my ball and go home if I don't get my way. There was a period of time where I had a crappy job and I had insurance, but it wasn't great, but it didn't cover my family. And Kathy did a great job of researching all the different options. And we looked hard at these kind of health sharing ministries.
Mm-hmm.
And by far, like when you go into the different places like Reddit and the different forums, they don't talk about like what's the pros and cons of this company versus this company. Which one has better financials? Which one has the best leadership? All of the forums are it's the same conversation over and over again. Hey, my company wouldn't cover this. Did yours? My company, I had to fight with my company to cover this. Did yours? And people were just having conversations back to back about like, hey, I've got diabetes. Will this company work with me or not? And all of it was fear-based what would be covered if I decide to go this route? Will I be taken care of for real? It's very scary, and
Hmm.
it didn't take that much scaring to understand, like, hey, if Obamacare is good enough for the U.S. Senate and Congress, then it's probably good enough for us too.
Yeah, and like in part of this, like I feel like what the objection is, right? It's like, you're like, if somebody goes to, like, Mariano's to get groceries, right? Nobody cares if Mariano's is, you know, being perfectly Christian. But when it comes to like their insurance company, it becomes an issue all of a sudden. And I don't really get that. But I think, part of it, what it is like somebody feels like if I'm paying money into this organization and they're doing anything, that I deem unacceptable, that I'm also then, tacitly, guilty for
Right,
having, paid into that system at all.
right.
If that's the logic you want, then, you're going to have to tell Jesus that he was wrong for saying, render unto Caesar what is Caesar's.
Yeah,
That principle of like, who cares what Rome does with the taxes they collect from you?
right.
You know, you can't control that. Just pay your taxes so you don't go to jail and carry on with your life.
Yeah.
I feel like that's kind of the way it is. Like, we live in a world that is overwhelmingly not really as Christian as it says it is.
Oh, of course, absolutely.
And, when it comes to insurance companies that don't even make the slightest claim to being, Christian, like, you can't hold it up to some Christian ideal. Your question is, isn't like, are you enabling this insurance company to do bad? Are you prepared financially to do what it takes to, take care of your family in the case of a medical emergency? If not, then health insurance is kind of where you need to go to make sure you can get you and your family taken care of.
Yeah.
You don't have to like it.
Mm-hmm.
I'm not saying you have to like it, but at the same time, you need to make the decision, based on what's going to serve you and your family. Because let's face it, whether or not you belong to insurance company A, B, or C, it's not going to change what they do and how much of it they do.
Right. Yeah. That's an interesting question about moral absolutes. Are there moral absolutes? And if there are moral absolutes, to what degree do you uh, conform your life around your perception of that moral absolute? Right. So in this case,
Uh-huh.
I don't want to give money to an insurance company who might pay out a claim that has to do with drug rehabilitation, right? Because
Right.
I believe that all druggies are losers, and I believe they should all be able to pull themselves up by their bootstraps, and they shouldn't have to rely on um, the charity of others. So that's a moral absolute, and I understand it, but that moral absolute only comes at the cost of other moral absolutes. You know what I mean?
Mm-hmm.
Love your neighbor as you love yourself. Um,
Yeah, I know. And it's like, there's this concern, like,
yeah,
because like in a lot of places that I've seen, like, abortion is the thing that comes up more than anything else.
sure,
And certainly they don't want to pay for drug treatment,
yeah,
because heaven forbid you think drugs are bad. So getting people off drugs is twice as bad.
right.
I did the math right, didn't I?
I think so, right?
But yeah, like abortion is the thing that comes up more often than not. And, but like the, wherever we see access to things like prophylactics and birth control go down, we see the number of abortions go up. It's painful to me that what people really don't want to admit, when they make these complaints, is the issue isn't, well, I don't want to enable people. It is, you want to punish people. Like, we know that people who don't, have your sexual ethic are going to go out there and they're going to have sex anyway. What you
Yeah,
don't want is there to be a pregnancy that somebody wants to terminate, you know, by force, if you
yeah,
will. So your choice is either like contribute to them having, less productive sex, for lack of a better way of describing it.
yeah. That's an interesting word.
But what they really want is these people not to have sex at all.
Yeah,
And if they did get pregnant, they want those people to suffer the consequences of having been irresponsible enough to go out and have sex.
yeah,
It's it's massive blinders. It's like, these are people who don't share your Christian ethic, or sometimes they are people that share your Christian ethic, but hey, sometimes, you're alone with your boyfriend or girlfriend, and well, you get frisky,
Yeah, I totally
and
agree.
punishing somebody for their whole life because of a momentary lapse judgment. That's not mercy. That's not grace.
Right. I totally agree that there definitely is, and this is so ironic, right? That this whole "we're being persecuted" crowd loves punishing others, right? So that's ironic. So there's also this element of there are people who refuse to acknowledge that complex problems don't have easy solutions, and certainly not easy solutions that can be put into pithy 10-word phrases. Abortion
Mm-hmm.
is murder, you know? Like, that's not a solution. That's just a moral judgment, is all that is. That's not helping anybody. Certainly not helping the young girl who thinks her life has just been turned upside down and who has no future left. That does nothing for her except make her hate herself and the world around her even more. So I think that's an
Yeah.
interesting. I would go so far as to call that a value of the modern American church, just to kind of turn its back on finding real solutions to real problems, and instead easily accepting the feel goodness of the pithy phrase.
Right. Yeah. It's a real big problem, in the church in America, at least in the present day. Right.
Yeah,
We see a lot of these issues coming up with there being a much more punitive attitude
absolutely.
towards sin. Like, we preach a gospel of grace, but when it comes to how we actually treat each other, it's very often just this punitive mindset. Like, you must suffer the consequences for your actions. You can't get off scot-free, except, what's the point of a punishment, right? Is it to show somebody that there was consequences for the actions, or is it to simply inflict upon them the judgment you think they deserve?
Right.
Because there's a big difference between the two. Like, somebody having a child that they don't want, and then being forced to raise it their whole life, that does not typically yield positive results.
Yeah.
It isn't just that girl that gets pregnant at 16 that suffers. That their child could suffer the entire life, because now you have a 16-year-old girl with a child who doesn't want to have a child.
Yeah. Oh,
Who starts missing out on the things of life. So she starts to resent the child. Like, this is not a good situation.
right.
You're not making, like, you're not making them suffer. You're making them punish somebody else.
Yeah. Oh, and by the way, that abortion that you didn't want to pay for is now going to cost you several times more in taxpayer money, in the form of social services, in the form
Right.
of welfare, in all the form of low cost housing allowances and all that kind of stuff. So congratulations on your great financial choice there. If this is truly a conversation about insurance and finances, congratulations on that stunning piece of math wizardry there. You know.
Yeah. And then, of course, that reminds me of just kind of the other side of this particular argument, is that you have a lot of these same Christians are complaining that, women are waiting too late in life before they have their first children,
Oh, jeez.
because, they dare to pursue career.
Yeah.
Yeah. Like, you know who these people are.
Yeah.
We talked about them last episode,
Yeah.
and the one before that, I think.
Right. Let's punish women for having aspirations other than being a homemaker and a mother.
Right.
Ugh,
Yeah.
jeez.
And, but kind of what it comes down to, it's like to bottle up this message for the Christian is like, look, you're in a pagan world, and you can either choose to use the products that pagans are selling, just because that they're covering things you don't like doesn't mean you have to use them for that purpose. But don't go to these unregulated, Wild West, freak show, whatever. I don't even know what words you to describe these healthcare sharing ministries, but yeah, like, they're not a good deal for a lot of people.